Hello, ladies and gentlemen, and welcome. We will be starting at about the minute after mark to ensure we capture our full audience. Please hang tight for the next 60 seconds, and we will begin today's webinar shortly. Thank you for attending today's webinar, Healthcare IT in Conjunction with COVID-19. Before we begin, there's just a few housekeeping items I would like to cover briefly. At the bottom of your screen, you'll notice a handful of widgets, namely the Q&A widget, which you can utilize to submit any questions you have throughout today's session. Our speakers will address the questions at the end of today's webinar. For viewing purposes, you can expand your viewing window by clicking on the icon found on the right corner of the slide viewer. If you have any technical difficulties at all, please click on the Help widget. And lastly, do take a moment to fill out the survey at the close of the webinar. And with that, I'll turn it over to our Senior Vice President of Marketing, Amy Protexter. Amy is fascinated by ideas and has a talent for connecting ideas into compelling messages. She applies the latest marketing ideals to Insight's global efforts to support and strengthen the community's identity as a problem-solving provider that puts clients first. In addition to her tenure at Insight, she has a long history of marketing leadership in healthcare and is passionate about the industry. And with that, I will turn it over to Amy.
Great. Thank you, Erin, and good morning, everyone. Good afternoon to those of you joining us from the East. I'm really happy to have you here today. We have just an exceptional program for you. But let me just say a few things before we get started. You know, I spent 15 years of my career in health insurance and healthcare delivery, and I saw firsthand how technology could expand the number of effective healthcare treatment options for patients. It's why today I'm so excited that we'll be discussing healthcare IT in conjunction with COVID-19 with healthcare experts Dr. Kraft and Dr. Morey. As the industry continues to evolve and adapt, especially today, patient care is still the primary focus for all healthcare providers. And thanks to modern IT, healthcare organizations can continue to provide services from diagnosis to treatment in a safe, efficient manner. At Insight, our teams are dedicated to supporting healthcare organizations of all sizes. All right, so now just a little bit about Insight. We are a Fortune 500 global company, and we provide a number of compelling solutions from digital innovation to cloud and data center transformation, connected workforce, and supply chain optimization solutions and services. We work with organizations of all sizes, and we provide a number of services to maximize business value of IT. From IT strategy and design to implementation and management, our 11,000 teammates around the world help clients innovate and optimize their operations to run businesses smarter. When it comes to healthcare, we're committed to providing an array of solutions designed to fit each individual organization's needs around mobility, point of care, security, infrastructure, data management, and so much more. We understand that healthcare as we know it has changed forever in response to COVID-19. Over the past several months, we've watched medical providers around the world adapt and respond to the pandemic, modifying their practices to ensure safe, efficient care. It's inspiring to see the different ways digital technologies have been implemented to support the public health response. From self-triaging to symptom screening, these tools provide some relief to our swamped healthcare workers while still keeping patients at the forefront. And additional innovations are most certainly on the way. As healthcare organizations continue to focus on addressing the challenges presented by the crisis, it's very difficult to predict what the industry will look like a month or a year from now. So we thought it might be helpful to hear firsthand from some exceptional healthcare professionals about healthcare IT in conjunction with the pandemic. So today's speakers, I'll get to the introductions and then I'll turn the program over to them. First, Dr. Kraft will be kicking us off with the current state of the healthcare industry as it pertains to COVID-19. Daniel Kraft, MD, is a Stanford and Harvard-trained physician, scientist, inventor, entrepreneur, and innovator. With over 25 years of experience in clinical practice, biomedical research, and healthcare innovation, Kraft has chaired the Medicine for Singularity University since its inception in 2008, and is the founder and chair of Exponential Medicine, a program that explores convergent, rapidly developing technologies and their potential in biomedicine and healthcare. Following undergraduate degrees from Brown University and medical school, Daniel was board certified in both internal medicine and pediatrics after completing a Harvard residency at the Massachusetts General Hospital and Boston's Children's Hospital, as well as fellowships in hematology, oncology, and bone marrow transplantation at Stanford. He has multiple scientific publications in medical device, immunology, and stem cell-related patient patents through faculty positions with Stanford University School of Medicine and as a clinical faculty for the Pediatric Bone Marrow Transplantation Service at California, San Francisco. Next, we will turn it over to Dr. José Morey. He will be closing with a discussion surrounding the future of IT within the healthcare realm, telehealth solutions. José Morey, MD, is considered the first intergalactic doctor and is a leader in exponential technologies innovation by leading multidisciplinary teams that sit at the epicenter of genetic intelligence, biotechnology, and precision medicine, as well as AI and aerospace. Dr. Morey is Chief Medical Innovation Officer for Liberty Biosecurity, was Associated Chief Health Officer for IBM Watson Health, is Chief Innovation Officer for Hyperloop Transportation Technologies, and is the Medical Technology and Artificial Intelligence Advisor for NASA iTech, which is an incubator created to identify and develop novel biotechnology to meet the 2030 Mars mission objectives and deep space colonization. And with that, I just extend my welcome to our speakers, and I'll turn the program over to Dr. Daniel Kraft.
Great. Thank you so much. Thanks for having me. Thanks to Insight and all of you for joining today. It's certainly an exciting time in health and biomedicine and healthcare IT, which really sort of starts to connect the dots in all things health and medicine. So in the next 20 minutes, I'm going to try and give an overview of what's happening in health, medicine, IT, and where technology is taking us. So clearly, technology is advancing rapidly, sometimes exponentially. Many fields have been disrupted, particularly in the internet-connected era. New business models have changed banking and how we get our movies, and disrupted many fields. And certainly in this year, unfortunately, 2020, COVID has been disrupting many of our lives, and in some ways is catalyzing and accelerating the future of healthcare. I love this slide. You know, who led the digital transformation of your company, the CEO, the CTO, or COVID-19? And unfortunately, COVID-19 is pushing transformation in good and bad ways. And, you know, it's still a novel coronavirus. We're still arguably in the second or third wave, and there's many other downstream elements we need to think about managing, from the mental health challenges to economic and beyond. And of course, in healthcare, we've got all the usual challenges in changing things from culture, systems, reimbursement models, plus all the other elements layered on from this pandemic. But it does give us a chance, an opportunity to think differently about the future and to bring it to us faster. And the future used to be thought about, you know, at the four walls of a hospital, but increasingly we're not thinking about healthcare in the four walls of a hospital or clinic. I helped lead a workshop on the future of the hospital with CEOs of several hospital systems. And our takeaway is that the future of the hospital is no longer the hospital. It's increasingly going to be virtualized care, going from hospital to home or hospital to hospital. But in this accelerating era, when I go back to visit Mass General or Stanford, where I trained, we're still using fax machines and paper forms. And I recently had a cardiac study. The only way I could get my data back was on a CD-ROM. I don't even own a CD-ROM player anymore. So we have lots of old systems and networks at play that sometimes keep us siloed. We're still doing public health measures like we did in the pandemic of 2018. And we're still often in waiting rooms, whether we're in San Francisco or Calcutta. So we are in this, connected digital healthcare IT era. We can start to break open the old traditional silos, or think about health and medicine outside of the traditional bucket of body parts in this genomic digital age, and really catalyze the future of health and medicine. Part of that rethinking is our mindset. Do we practice healthcare or sick care? Or can we really go to self-care? Today, we really live in a sick care world where we traditionally get our data very intermittently, in that 0.0001% of the time that you might be visiting your primary care doctor or in the ER. And that's where we usually collect our data. It's intermittent data, it's episodic, and that leads to our reactive sick care models, where we tend to wait for the patient to show up late with a heart attack or stroke, or in my world of oncology, often to present with late-stage cancer, where it's difficult or impossible to treat, or wait for the pandemic to arrive. And so I think the potential of a lot of healthcare IT and the new ability to connect the dots is to move to much more continuous care that's much more personalized, much more proactive, and can start to bring care anytime, anywhere, at lower cost, at better outcomes. And move to truly an era of precision medicine instead of imprecision medicine, because many of the drugs we give today only work for a subset of the patients. So we really have the chance to move the needle to more proactive, preventative, predictive healthcare, and even to think about precision wellness. And not just to have long lives, but health quality, health span can be optimized rather than just number of years of life. So lots of elements coming together. The future of medicine, I think, is bright. This is the cover of National Geographic last January. I was lucky to write the opening article for this this Nat Geo. They kind of retitled the story on me, 12 innovations that will revolutionize the future of medicine. And actually, the point of my article, it's not about any one innovation. It's how they're coming together and converging to allow us to reshape things. And many of these technologies are moving very, very quickly, sometimes exponentially. The favorite example we all know of exponential technology is Moore's Law, the power of computing getting twice as fast and half the price every 16 to 18 months. That's why our smartphones have the power of a crazed supercomputer. In fact, this is my antique iPhone 2. It's 12 years old. It felt amazing 12 years ago. Now it feels slow and clunky. My iPhone 11 will probably feel antique in a few years. It'll probably be shrunken into my Apple AR goggle set. So lots of changes are coming exponentially, which is why so much of the technology we grew up with has been digitized, democratized, demonetized, and fits into our pocket. And that's coming to healthcare. Our smartphones themselves are becoming important in COVID and contact tracing and for doing diagnostics. And so using exponential technologies can really accelerate where we are now, and what's coming in the next decade, I think arguably will make the last 10 years look slow. Bill Gates has this quote, "We tend to overestimate what will happen in a year and underestimate what will happen in a decade. Watch out for the next decade." So I'm going to frame this quick talk on what's possible today with connecting dots with health IT and health and prevention, diagnostics, therapy, and discovery. And of course, a lot of this does live in our exponential smartphones and health IT. They're really becoming diagnostic platforms, not just for communication. You can look in your kid's ear and diagnose an ear infection. We're even seeing Apple and Samsung come out with non-invasive glucose monitoring and blood pressure based on your mobile devices. And so our exponential tech has taken what used to fit on a desktop, now fits on our mobile devices, and our wearables are becoming FDA-cleared medical devices. And these are not just siloed. They're starting to be connected to our Internet of Things or Internet of Medical Things, crossing the entire care paradigm, riding 5G, 100 times the speed of 4G. The challenge with all these exponential technologies and wearables and others is that they create massive amounts of data, but that data is often still siloed. We have big challenges with interoperability from our EMRs to our wearable device, to our imaging information, to our genomics. And so challenge, and what's being enabled by many of you, is to shift from new forms of data that's often exponential to convert that into information and insights. What we need is the information, not the data, the insights from that, and to take that information, insight, and translate that to knowledge that we can use at the point of care, whether we're a consumer, a patient, a clinician, or a healthcare system. And of course, the incentives are changing. We no longer just practice evidence-based medicine. We're practicing incentive-based medicine. We're starting to shift the incentives to better outcomes for drugs, devices, virtual platforms, only way work. Some of these incentives, of course, are shifting where care happens, particularly in the time of COVID. Virtualized care from hospital to home to our phone to even on and inside our bodies, or to your corner pharmacy, which is battling it out to become a primary care center, or to virtualized platforms rolling out by many providers and healthcare systems. Even Walmart and CVS building entire new centers, which will have everything from veterinary care and eye care to clinicians on site. So all of this is coming together in our new era of connected, mobile, digital health. Those are buzzwords. I think we're going to just soon call it health. But bottom line, we connect our health data, hopefully convert that into apps and services that are personalized to the individual or clinician or healthcare system. And it's not just about digital and AI and data. It's where we're going with 3D printing and synthetic biology and robotics and virtual reality, all converging, super converging, to enable us to do some pretty amazing things at the interface of technology and healthcare. In fact, entire fields that didn't exist 20 years ago, from digiceuticals, continuous monitoring, designer antibodies, AI meets drug discovery, are all moving quickly and are enabling us to do things differently in health and medicine. In the era of COVID, I'm chairing the XPRIZE Pandemic Alliance Task Force, made up of over 100 organizations. And part of what we're trying to do is connect the dots between solutions and unmet need, and to catalyze the new solutions forward using some of these new technologies and networks that are emerging and accelerating discovery in the time of COVID. Now, technology, of course, is important, but we're learning, particularly in the time of COVID, that social determinants, our zip code's more important than our genetic code in terms of longevity and even our risk for disease. We're seeing that our social determinants have played an important role in who's having complications and getting COVID. So we need to have a lens on addressing those as well. Some of our social determinants are driving our epidemic of obesity. Sometimes we can do simple things to address that. Clean water, good food in schools, or doing something simple with a child at 6 months of age when you start to give them, cereal. Don't make it that sort of white rice cereal. Use it, make it whole grain. That changes the microbiome of the baby, changes their epigenetics, and their risk of obesity and type 2 diabetes goes down dramatically. So we can do simple things. So it's a time of reimagination. Uber has disrupted taxis. Uber's now getting into healthcare, maybe to press a button on your app and a nurse will come to give you your flu shot or hopefully eventually your COVID vaccine. We're seeing the Uberization of almost every sort of service. Press a button and get what you want. We've seen, new big players from Amazon and Google and Apple come into healthcare and disrupt how we're going to do healthcare delivery, and maybe even start to deliver our medications by drone. It's happening for real. Even disruption to our friends in pharma. One-size-fits-all blockbuster drugs are going to be on our way in our era of personalized genomics. So disruptions coming to almost every industry, including the payer world, how we interact with our health information. And so I think all of us, we don't want to be the disruptee. We want to be the disruptor. No one wants to be the next Kodak, right? That got disrupted by Instagram and digital photography, even though they invented digital photography. So we all want to be Ubering ourselves before you get Kodak as we move into this brand new world. I've been lucky to play a role in the interface of this. I share Medicine for Singularity U and have founded and share a program called Exponential Medicine. The theme there is that we need to bring folks from all sorts of worlds together: patients, investors, technologists, healthcare IT. Every element needs to come together if we're going to shift things forward. And it's not just about tech. It's sometimes about mindsets. Tony Young, the head of innovation at NHS, shared this old quote: "The difficulty lies not in the new ideas, but in escaping from the old ones." So what old ideas might be holding you or your colleagues back? How do we help the regulatory bodies like the FDA, that's getting on top of digital health, move forward to think about software as a medical device and catalyze faster regulatory paths? In fact, just yesterday, early this week, the FDA launched a new digital health-focused center of excellence to help catalyze digital and connected solutions. So check out exponentialmedicine.com. We'll do a virtual program this year. Lots of great talks there from thought leaders and innovators across the spectrum. Okay, let's look at 3 areas quickly and how health IT and how things are shifting across the paradigm. Starting with health and prevention. We know that our most of our costs and complications in health and medicine are driven by our bad behaviors, not by our genetics. Poor diet, not enough smoking, too much stress. Now we can start to measure our behaviors. 17 years ago, I did a project with NASA to build a black box for the body for astronauts. Now we have that built into our wearables. And Fitbit only launched, 11 years ago. Things are moving quickly. Most of us are wearing some sort of device. I'm wearing 4 of them right now. And these can start to measure almost every element of behavior and physiology, enable us to do some amazing measurements, not just from sensors on our wrist, but even sensors shrinking inside pills or becoming digital tattoos, or even Amazon coming out with a new wearable that will use voice and other metrics. And it doesn't need to be fancy. We can use small data from these devices, like sending a patient home after a hip transplant, a total hip replacement. We can now measure, are they walking more or walking less? Or if they have COVID, how's their mobility after a discharge or while they're at home sick, tracking them with a simple pulse oximeter. So we can use small data. And my hope is that many data geeks like you and me, we are quantified selfers. We have our data stuck on our phone. That's going to start to shift to quantified health. It's going to flow to our healthcare providers and to our systems to enable better measurement and wellness, better early diagnosis, and better feedback loop-driven therapy. Just a few examples of what's available today. We can start to measure blood pressure on a connected cuff, or not even have to have a cuff anymore. There are new radar-based forms that are going to connect and collect our blood pressure seamlessly, just from a patch or from a watch band. We'll see the evolution of glucometers that come to our wearable devices as well with no sticks. And we're moving just from wearables to collect data, but even insidables, chips underneath the skin that can measure physiology and transmit that 24/7 through our 5G or maybe satellite-based connectivity. And beyond that, we've got shockables, hearables, our music devices can measure our physiology, give us coaching. Exponential technologies that's shrunk into our rings. A ring can be a sleep lab, essentially. If you do nothing else with this technology, just track your sleep with a wearable, an app, a ring. That is huge implications for our future health. And fun ways to take care of that at work and beyond. There are other things we can measure. Breath. It could be a breath biopsy to detect cancer or COVID. We can even detect the quality of the air if we're breathing. Smogables, sensors you can wear that can be crowdsourced to show you the quality of air in our fire setting recently. And by the way, global health and global warming definitely impacts human health. We all need to play a role in impacting the future of global health. And that's bringing us new wearables in the era of COVID and in pollution that are getting more and more important. Other things you can sensor. You can sensor your socks for a diabetic patient to determine whether they might be getting early blisters or a wound and pick that up early. Or my favorite is underwearables. You get a pack of 10 of these devices. You put one of these in your underwear band. It's lasts for a year. It can go in the laundry. And you can track with now remote patient monitoring, which is being paid for, whether a patient's having a respiratory challenge, whether it's with COVID or a pneumonia or beyond, and act proactively before they might need a hospital admission or readmission. We can start to manage pain, not just with scribbles on a piece of paper, but start to quantify that with apps and other devices. We can even start to quantify our food, our most important drug. We can measure input, and we can start to measure output. And of course, this information is becoming more useful as we move into this era of food as medicine, precision nutrition, using all this new data from our microbiome, our genome, our metabolome, to give us not just a fad diet, but one that really matches us for prevention or even for therapy. And then, of course, data is coming at us in new ways. The idea of invisibles. We don't need to be devices. Our cameras can pick up physiology. There's now apps out that can basically measure just from your camera on your smartphone or laptop your blood pressure, your OSU-sat, your heart rate, and use that as a quantification measure. So new ways to measure everything from cameras tracking behavior to voice as a biomarker, can measure mental health, pick up Parkinson's disease. The sound of your cough might determine if that's just a cold or coronavirus. We're in the era where our Internet of Medical Things, our Wi-Fi, can pick up vital signs of up to 10 or more people in a room at the same time. So incredible ways now to collect our data so that we're, in a sense, whether we like it or not, collecting our digital exhaust 24/7, our digitome. What do we do with that data? Who owns the data? Is it the big players, the consumer companies? Is your insurance company going to incentivize you to walk more or less if you're and have you a lower premium on your life insurance? That's happening. Does your doctor or nurse want more data? Here's a cartoon. What is it, doc? Just as I thought, you're generating too much data. Clinicians don't want too much data. We're already overwhelmed with our world of healthcare IT. We need not to be burnt out by our EMR systems and beyond. We need to think about better workflow. How do we integrate all this so we upskill and up-level and have improved clinician experience so that these technologies are used, and we align these technologies so that they're accessible, digestible, and more importantly, reimbursable and connected to care in smart ways. That, of course, is starting to happen. Apple HealthKit and Common Health are platforms we can integrate data on our mobile phones, start to connect that to our EMRs. Now, my doctor at Stanford can look at my Fitbit data, but what does we do with that? What does it mean? So we're starting to see crowdsourced trials like Verily's Baseline trial and the NIH All of Us trial. Crowdsource volunteers, data donors like myself, I've signed up to share our digital exhaust, our genomics, our medical records, so we learn what our digital biomarkers mean in the real world. And that brings us to where we'll go with sort of what I call predictalytics. We'll start to have essentially a personal check engine like integrating all of our data into a useful form for yourself or your clinician to make use of, kind of an OnStar for the body. And that means we're going to start to have continuous physical exams from our wearable devices, which can start to pick up, do you have the flu from your wearable device, your Apple Watch? In fact, smart watches can now determine who likely has COVID, even when they're asymptomatic. And we'll start to blend that with our outsourced data. You can report whether you have COVID or not, or whether you're tested negative. Or now, just announced today, Google's going to update their maps so you can tell if there's COVID in your area at very specific levels, or through social networks. So it will be part of our contact tracing future where we're going to know who to be socially distanced from. Do I shake hands with Jose, or do I keep my social distance? That sounds funny, but that's coming soon. Now we have all this data. What do we do with it? How do we make it helpful to change behavior? Because behavior change we know is hard. Digital coaching is coming. You can have a real coach or an AI coach. Platforms like Livongo can help us with our diabetes and coaching and data. We're going to see more forms of this come to sort of avatars that feel real and can personalize our communication. So new forms of coaching will help change behavior. That means we need design thinking, because we all sometimes respond to health and other information differently. Millennials versus baby boomers don't relate to information the same way. A millennial wants to Snapchat their doctor. The baby boomer still wants the face-to-face, hands-on, hand-on-the-shoulder care. And we're seeing this design thinking coming to new clinics like Forward and others. Voice can be useful for a modification of transmitting coaching. Lots of apps are coming to Alexa and Google Home. And we're going to use these kind of coaches that will talk to us through our mirrors and beyond to give us personalized data. They'll show us you of today or you of tomorrow, before you started smoking, and what's going to happen after you smoke for 10 years or spend too much time on social media. Powerful levers for instigating change. And that brings us to this convergence of augmented reality, virtual reality. I still have my antique Google Glass, or now we have new versions of AR that's going to help the surgeon or the interventionalist see through the patient's body and do smarter procedures. Or AR can help a medical student or resident train in a virtual environment with a virtual patient. This one's a simulator for treating COVID patients. Or we can use this information to see inside our own bodies and help patients understand their physiology and disease and be much more on top of that. Great for kids like my son Leo to understand their physiology. We can use virtual reality, which is becoming really magical. It's fun to put grandma on a roller coaster, to use not just for games, but for therapy. You can put a burn patient who's got lots of pain into a cold environment. They use less than half the opiates. Or for mental health, or for physical therapy, or even for virtual yoga. All sorts of new ways that we're able to virtualize our workouts and beyond. So watch that space. And as Jose will talk more about later, we can use VR for simulation and training to train surgeons. It can live stream a surgery or do more and more simulation and coaching with a virtual coach back pocket. So lots of things are happening in that space. I'm a little behind time, so I'm going to switch to diagnostics and therapy. Lots of things coming in the healthcare IT world of diagnostics. We now can obviously use low-cost or lower-cost MRIs to look at our brains and quantify our bodies. Those technologies are getting exponentially more cheap. We're seeing now the advent of MRI machines that have just come to market that are 20 times cheaper than traditional ones. And are mostly, I think, technologies where you go into your CVS or Walgreens Minute Clinic and you'll get a whole body MRI scan in 10 minutes measured with an AI radiologist. And now all of us in our pockets can have the equivalent of a medical tricorder, an integrated kit that can track our COVID symptoms or more complex ones to blend with our virtual telehealth world. So you're not just talking to a doctor or nurse. They can use these virtual elements like TytoCare to enable you to have home-based diagnostics to blend with your virtualized visits. And many examples of those are coming, including a consumer ultrasound with AI built in, so we can do your own home exams or democratize diagnostics and medicine around the planet. Now, finally, the power of all this blends with our laboratories. We're now seeing the ability to do, lab on a chip. You can connect a small testing platform that can go well beyond just tracking your blood glucose to tracking all sorts of lab measures. Even your phone camera can be used for a medical selfie. You might have a urinary tract infection. You don't want to bring your urine to the lab. You dip it in and measure that with your smartphone camera, and that's sent directly to the doctor or the pharmacy, and your antibiotics are delivered by drone. A lot's happening there. And of course, with COVID, we need better, faster, cheaper, and easier testing. Some of those are going to blend with our smartphone. With the X Prize, we designed and launched a rapid COVID testing X Prize for tests that are frequent, fast, cheap, and easy. Let's say under $5 can be done in under an hour, can help us unlock and reopen schools and workplaces safely. Over 707 teams from 70 countries entered the competition. It's underway. We've now narrowed it down to the top 200, and we'll hopefully have our 5 top winners this fall, which will hopefully get accelerated to market. So testing is key, as well as our ability to connect the dots with healthcare IT to understand who's been vaccinated, who's been tested, that digital yellow card. Finally, we need to start to connect the dots. We have all our genomic information, our digital information. How do we make sense of all that? It's overwhelming for any clinician, let alone patient or healthcare administrator. So we're using AI, or IA, intelligence augmentation, to start to make sense of this information, whether it's AI radiology to diagnose COVID, or pathology, or increasingly even gastroenterology can be layered with AI to help augment the clinician. And so where we're heading to this is a world of a digital twin. We're all going to sort of have our simulated physiology in the cloud. And it's going to help our clinicians and nurses, not to replace a doctor or nurse or pharmacist, to blend them together. Doctors, AI is not going to replace the doctor, but the doctor using AI will replace those who do. Last point will be therapy. Lots happening in therapy. Virtual visits have exploded in the era of COVID, especially enhanced by HIPAA regulations being lessened and better reimbursement for Medicare. A lot of these telemedicine visits can start first with a chatbot that can help diagnose COVID or triage you and then upskill you when you need to talk to a clinician. Digital mental health is exploding onto the scene. And we're even in the era of prescribing apps for managing mental health, smoking, managing hypertension. There's so much out there now. We can even start to prescribe video games for treating ADHD. It's hard to make sense of that. So I recently launched a new platform called Digital.Health, a bit of a digital health formulary where a clinician can provide and find the digital health tools that will match their patient. So check out Digital.Health as a platform to learn about what's happening, what's available now, what you can essentially start to prescribe for your patients. I'm going to skip for the interest of time, just to close. We can 3D print medicines. I'll skip that. Just the idea of discovery. The last part that's important is now we need to accelerate things in the time of COVID. Clinical trials are being virtualized through our Internet of Medical Things and apps and devices. You can all download a clinical trial yourself. And so my hope is that the future of health and medicine is increasingly crowdsourced. Just like we drive now with Google Maps and Waze, imagine we built the Google Health or Waze for healthcare. We're all sharing part of our healthcare journey, whether it's for COVID or mental health or cancer or diabetes, so we can all learn from our healthcare journeys and bring that together. We can all not just be organ donors and blood donors, but data donors. And in fact, there are companies now building a health Waze. There's one called StuffThatWorks.Health, where if you have a chronic condition, you can share with other patients like you what's working, what's not working, and that data comes back to you in a community to help inform what's useful for you or patients that have this condition. So the future of health and medicine and health IT is bright. It's this blending of data, sensors, informatics, AI, machine learning, Internet of Things. And then if we can blend this convergence, we're in a pretty magical age in 2020, but we want to be like Wayne Gretzky and skate to where the puck is going to be. And that will all enable all of us to get out of our linear mindsets, to have exponential ones, to not just predict the future of healthcare, but build a brighter one for all of us. So thank you for your time and attention. I'm going to hand it over to Dr. Jose. He's an amazing radiologist, an Eisenhower Fellow, who's going to share a bit of what's happening in healthcare IT as applied to COVID. Over to you, Dr. Morey.
Thank you, Dr. Kraft. Yeah, appreciate that presentation. Very enlightening. I'm sure the audience really appreciated it. Start now, essentially discussing the technology that's having real-world implications during the time of COVID. Dr. Kraft covered several of those things as well, but we're going to deep dive into some. And really the transition that we're seeing right now is going back to Darwin, not the ones who were the smartest, or not the ones who were the strongest, but really the technologies that are able to most adapt and the companies that are most able to adapt are the ones who are really seeing the transition. And what we've seen right now with COVID, obviously some of the real world impacts, most important being the loss of life, seeing the transition from elective procedures being mitigated, or not having as many procedures, major supply chain disruptions, and obviously we're starting to realize that our underlying infrastructure that had some systemic inequalities have been exacerbated during a time of acute stress, such as we have during an epidemic or a pandemic. And we're starting to realize, and people are starting to have real discussions about having a strong healthcare system is equal to having a strong economy. They both go hand in hand. There's been a lot of real world change from healthcare delivery perspective. We've seen the shift again. Daniel discussed this to a certain degree about how we're having a decrease in acuity. We're no longer thinking about brick and mortar and tertiary and coronary care centers, but we're looking really to transition to places of lower acuity, perhaps CVS or a Walmart. We're looking to start utilizing more telehealth and telemedicine. We're seeing an explosion in those things. We're seeing also a change in the way that shared cost models have been done, or distribution of healthcare products and healthcare delivery as well. And obviously consolidation, seeing the fact that smaller providers or small companies having to merge with larger providers to really be able to progress in the continuum of care. As Nietzsche said, that which doesn't kill you makes you stronger. And the issues that we're having and some of the transitions that we've been seeing really had implications beforehand. They were just exacerbated by the current pandemic. We were already in a stage in which smaller hospital systems were in danger of shuttering, as well as small clinics and small medical startups were having issues with that as well. And we've seen this meme, Daniel brought it up as well, but this transition that we've talked about, and really executives have been discussing, oh, should we do this, should we not do this? Well, the decision maker ended up being not your typical CEO or CTO or even your CIO, but really COVID-19 has been the one that's caused the greatest digital transformation within healthcare companies. One of the reasons that this has occurred is this old school mentality of doing business that kind of has been perpetuated throughout healthcare. This concept that we want only to have stopgap measures, or perhaps we don't want to have extensive PPE, or we only want to focus on offshore supply chains because that is cheaper, or we just want to focus on just-in-time delivery. Well, those kinds of things have been completely tipped over by COVID, this whole concept of the old school mentality. And we've seen things that previously were thought, well, too risky to do, perhaps having an overabundance of respirators or having an overabundance of proper supply chains on this side of the water. Well, those things are now what is status quo. And we're seeing that all companies and healthcare systems are starting to align themselves with those types of workflows. Obviously, the biggest impact from a technical perspective or from a technology digital perspective has been telehealth. Daniel discussed some of these already. Some of the biggest movers in this has been obviously something like Teladoc and Livongo. Livongo and Teladoc have both been around for a while. Daniel discussed how Livongo is really around kind of kidney care and diabetes care primarily. Teladoc has also been doing these kinds of things where people can go and get their health care 24/7 and actually go over both the diagnostics and the therapeutic treatment plans. Creators of CNBC discussed how this has essentially created a huge powerhouse within the healthcare market, but they're obviously not the only big telehealth player or Silicon Valley type company that has been trying to do this or moves into the space. Ro is another big player. Ro is more famous probably for their Roman, which is particularly healthcare services for men, the Rory, which is healthcare services for women, and their Zero programs, which is a smoking cessation program. But they were one of the first that actually got into the COVID space, creating a COVID telehealth assessment for people to actually take advantage of. They've done a new infusion of funding that has helped them transition to this kind of new healthcare space. And they're also looking to do other types of modeling where they essentially would become the first person or the first application that people would turn to for their healthcare delivery. But what most healthcare systems are, and what I'm assuming some of you in the audience might be thinking, is this truly a fad or the future of medicine? In that evolutionary mindset, is this just going to be vestigial, or are some of the other models vestigial? We no longer will need them going into the future. Well, I would submit that there are three major components or three major data points that really promote that this will be the continuum of care into the medium and long term. The first is the baby boomer generation that Daniel Kraft talked about in his presentation. And I'll give my parents as an example specifically, and I hope that they're watching. I mentioned that they might be. That generation, particularly my parents, they weren't getting health via online. They weren't doing telehealth visits. It wasn't the type of model that they had. Perhaps my nieces and nephews who are in their early 20s, that might be something that they did, but my father, who's 75, that's not the typical type of healthcare that he would receive. But during this new transition, during this new area of COVID, that generation, he and others, have been seeking out healthcare applications online. So when you see the market move in that aspect, when you have the actual clients or the patients, they're now looking to do those new type of models, well, everyone else will follow suit. So that is the first point. The second point is seeing the big players that are changing, the old traditional type of players within the healthcare space. Yes, perhaps the Roes, the Rorys, the Amazons, those are ones that you might be able to expect that would be taking advantage of this kind of situation because they were kind of prepared for it. But the companies that are now making the transitions also add more data saying that this will be something that moves to the future. Things like this, where you have Blue Cross combining with Cricket to be able to form new types of healthcare delivery models from traditional players that weren't doing this previously. The biggest one that has done this, that just came out as of yesterday, has been Walmart and Sam's Club, combining with 98.6 to start delivering care through telehealth applications. The other aspect that has been transitioning is how you actually do care remotely from, let's say, the operative theater. Daniel discussed this in some respects as well. This is a company called Immertech, which has been delivering virtual reality applications from inside the operative suite. And different types of entities have been taking advantage of this. One of the ones has been primarily medical training. University of South Florida and other institutions have been implementing this to help their residents and other staff to be able to keep continuing in that training model where you have to have not as many people within a healthcare unit because of the COVID situation. The other model that's been really transitioned to this type of applications is actually how the big companies like Boston Scientific and Medtronic actually interact with their hospital systems or with their clients. Not being able to see them due to travel implications, well, they've been able to utilize this type of software and hardware applications to be able to change the paradigm of how they interact with their hospitals. Robotics is seeing a huge transition as well. They're able to deliver care. In Asia, you've seen a lot of these types of things. These are some robots here doing food delivery, just food delivery for people that can't reach those kinds of things, but actually having robotics that are creating food in real time for healthcare workers and providing them access to food. Other robots like the TMI robot, which actually go around the different facilities and use far UVC to actually clean the different hospital settings. You have robots like this that can evaluate whether you're wearing your mask properly, you're taking your temperature in real time when you go into the hospital, right? To go around cities and check people's temperature to be able to screen for COVID has been transitioning. Other robots such as drone delivery that Daniel mentioned as well have big implications. Amazon has been doing it, but then the next big player that also just transitioned into it has been, again, could have guessed it or not guessed it, is Walmart itself doing drone delivery for COVID testing applications. The other big digital transformation that we've been seeing is utilization of things like environmental data and tracking data with telecommunications. They've been doing a lot in Southeast Asia and ASEAN. This is a group of medical technologies out of Thailand that has been in conjunction with the Ministry of Health, being able to actually give risk stratification scores at a granular level to individuals and then obviously to the individual regions, so that both the Ministry of Health and the Ministry of Commerce and Economics can evaluate which regions are at greatest risk for spread. This has allowed them to do two things. One, from a logistical perspective, be able to analyze where respirators may be needed or PPE may be needed to be able to transition those types of supply chains to help the places that need it or are predicting that will be needed. And for the places that don't need it as much, they can actually downgrade how much supplies are going to those regions. So be able to modulate that in real time with AI applications. The other thing that they've been utilizing it for from a commerce perspective is being able to give precision openings or phasing to these different regions. Being able to analyze, all right, how are we going to open different areas using real data and saying that these areas are at higher risks, they need to stay at a higher phase, and they have to have lower, people aggregating in different situations, as opposed to other regions that have a lower health risk score or can open at a higher clip. These are the type of surveillance programs that people have for coronavirus. This is, again, from the other medical space, looking at their dashboard that can be utilized both for regional surveillance and also from essential surveillance, to be able to evaluate how things open over time and how you risk stratify over time. NASA Breathing Space Initiative has been utilizing similar types of technology. NASA has been having issues, obviously, with, like everyone else, not being able to utilize their spaces appropriately, not being able to have people actually come to their facilities. So looking at utilizing similar types of underlying technologies to be able to aggregate. Also looking to combine different siloed data sets. Daniel spoke about being able to have the breathables, or being able to smell different types of bacteria or viruses. NASA actually has an e-nose, or electronic nose, that has been utilized looking at those types of things for the International Space Station and for space shuttles, to be able to pick out different types of viruses, bacteria, fungi, proteins from the air, and be able to analyze it. Looking to implement or to aggregate both telecom data with that kind of data with EMR data, to be able to do similar types of technology to analyze how we can open these things up, and also predicting where things could spread in the future and over time. Obviously, this is built on top of different types of machine learning and artificial intelligence. This came out of a paper that myself and a couple colleagues wrote just a few months ago, utilizing and visualizing what types of AI would be useful from this kind of data set to be applied to deep space. But other types of digital transformations have been around vaccinations. Obviously, we're all in hopes that a vaccine will be delivered soon. A lot of the new vaccine technology that's out there actually came from research that was done previously at DARPA several years ago, maybe 8 to 10 years ago. Now there are new types of vaccinations that are coming out, or that are starting to be developed through DARPA, primarily looking at trying to bridge the gap between patient zero and then when the vaccine is actually created, actually looking to create something that they call a COVID shield, to be able to create B cells that can protect you 3 or 6 month intervals at a time before the vaccine is finally created. AI is also transitioning in how we deliver care, both from a research perspective and from a diagnostic and therapeutic perspective. One of the applications that I've been a part of is through the White House Office of Science and Technology, called the COVID-19 project. And what this has done is brought different AI centers and experts from around the country together to be able to utilize machine learning and natural language processing to evaluate all the data, the tens of thousands of papers that are coming out from all over the world in all different languages, be able to translate them in real time, be able to evaluate them in real time, and be able to create metadata applications. So you can do meta-analyses using artificial intelligence to help expedite two things. One, to see where the data is taking us and saying, all right, well, this is what we're learning from COVID right now based on all this data, but also to analyze where are the data gaps, to be able to have the AI tell us, hey, these are the things that we still do not have. These are the things that you should go out and research. So those are some of the things that we're coming out and published and spoken about in Nature. Daniel talked about precision therapeutics. Artificial intelligence is really changing the game and the paradigm when it comes to how we discover drugs. This is from a company called Atomwise, but there are many other companies out there that are utilizing new types of AI to evaluate protein folding and to really change how drug discovery is occurring. Drug discovery, obviously, we know is something that takes potentially decades and tens of millions of dollars. So if we can change that to be able to utilize that for COVID and for other diseases as well, we can identify which drugs are the ones that are going to be most likely able to give us the results that we're looking for, and hopefully reduce the amount of types of side effects and also the late stage kind of medications that end up not being able to go through phase 3 or phase 2 as we go through the entire process of FDA approval. And a lot of companies are doing this. This is, again, Atomwise, but one of the largest research databases out there that's been done, or research that's been done, is actually through Facebook. Facebook's actually done one of the largest studies of protein folding to date. But hopefully soon we will be able to have a vaccine, as long as Norris can give us some of this blood. We'll all be able to get back to our normal lives. But I'll leave you with Mr. Darwin. Again, this is something that we are going to be seeing time and time again. this is just one pandemic, but we're going to have other things in the future, and we have to be ready to be able to be malleable from a healthcare perspective so that we can be there for our patients and for all of us. Thank you very much.
Thank you so much to both of our speakers. Speaking for myself, I am so blown away by everything that is coming up in the healthcare realm. So at this time, we will be leading a question and answer section. So we're going to start off with the first question of today. So either Daniel or Jose, you can take both of these questions. So the first one was, when will dentistry really join the healthcare industry?
Dentistry? I've actually met some very... Dentistry, like teeth? I've actually done a lot of interaction and innovation in that space, from 3D printing replacement teeth to 3D printing to now personalized braces, which is very common, to understanding the microbiome of the mouth and its role in not just periodontal disease, but risk for neurologic disorders like Alzheimer's. And there's several very innovative dental groups and practices and dental schools that are really coming into the technology age, including how you even use AI to look at films and beyond. One small project I did at Singular University with some students was design a 3D printed bite guard that would wash your teeth. So personalized dental hygiene. So I think there's a lot of interface between dental, veterinary, almost every field that crosses the dots in healthcare, public health that can be upskilled with some of the new technologies that are here and are coming.
Yeah, I would say, and I apologize, I just found out my audio was a little choppy. I apologize for that. But I would echo the sentiments that Dr. Kraft said. I think the biggest one is obviously around oral health. You mentioned neurodegenerative disorders, but we're finding more and more how the microbiome of the mouth really affects not just the brain, but cardiovascular disease and potentially other sequelae and other types of disease processes. So as we start learning more about how that actually interacts with other issues that we have in our body, I think that's going to be one of the biggest transformations from an oral health perspective.
So low tech, keep flossing and brush your teeth and water pick. It doesn't take high tech to help manage that.
Awesome. Thank you to you both. Our next question, and these will all come from our attendees, is telehealth struggles greatly with the need for translation services. How does your platform integrate with those services? Or more so, how do you foresee the future integrating with IT and healthcare?
For translations, yeah. We're seeing a lot of big movements with natural language processing, and we're seeing this all over the world because a lot of data needs to be translated in different perspectives. So NLP is making huge leaps, and we're seeing that actually in tourism as well, utilizing translators in real time that are offline. One of the biggest leaps forward when it comes to that type of technology has really been edge computing and edge AI, which you're seeing huge leaps as well in that. So we're starting to see those types of applications be very much needed. Obviously, especially in a place like the United States where we have a melting pot and we have a lot of people perhaps from Central and South America and originally from Puerto Rico needing those types of translation services is hugely beneficial. Obviously, because there's also not enough medical translators. You go everywhere in the country, and that's always a big issue. Right now, things are pretty low tech when it comes to that. Either you use someone physically or perhaps you have a phone, right? And you have this kind of translation service that covers the hospital. But these types of new technologies where you're utilizing machine learning, AI, and NLP to do translations in real time are going to be the things that will really disrupt the translation market when it comes from the healthcare perspective.
Yeah, already today you can see on platforms like Zoom, real-time transcription, or platforms like Otter that will use AI and NLP to literally listen to your conversation and write it out for you, and also the ability to translate that essentially in real time. So that can enhance a telemedicine visit. We're now seeing machine learning and NLP enhance the electronic medical records. So if Jose and I, he was my patient, I was talking to him, it would be listening and basically write the note for me, or at least the key elements, so we don't have to spend too much time typing data into our EMRs, which contributes to burnout. So there's lots of things happening in voice, and including the Amazon Alexas and Google Homes listening in your environment for a fall or a call for help. The voice space is fascinating and going to blend more and more with healthcare IT.
Great, thank you. So our next questions, we've gotten a couple surrounding security specifically. So this one says, with the evolution of technology serving healthcare, such as apps, wearables, et cetera, patient information security risks also increase. How do you reconcile the benefits versus the risk?
I'd say that we need to be smart about it and not be fear-based. I think we have the famous HIPAA regulations, which were pretty much written before a digital age, which in my perspective have often harmed both patient care and our ability to share information. It's become over privacy instead of ability. So we need to rethink our regulations, but also be very mindful about privacy and data that can come from our simple wearables to our internet-connected homes. Let people opt in to share and be a data donor when they want to be, and even be rewarded for that. And use technologies like blockchain that increasingly can keep data more secure and understand who's been accessing it and changing it. It's no silver bullet. I think we need to think smartly, and there's different cultures, GDPR perspectives versus what happens in Asia, and more folks are open to sharing. There's a whole spectrum, and I don't think we can lock it down or completely ever make it secure. Our banking, our credit cards still get hacked occasionally, but be smart about blending smart privacy with smart sharing so we can really accelerate learning and care.
Yes, this is an excellent question and a hot topic. I was actually on a IT CASEL panel this morning having this very discussion. And it's a great question. We do need to be very careful. I think one of the things, the most fearful thing that I have from this perspective, and I share Daniel's sentiments that we need to have a balance, but I think a lot of startup companies don't ever consider safety and cybersecurity when they're developing their products. And that's, I think, the biggest shift I would say that we need in the mindset that Silicon Valley and other kind of entrepreneurs and innovators need to really be considering cybersecurity. But from a healthcare perspective, if you look at most of the things that we have in a hospital, a lot of the things that are connected to the hospital, the smart equipment, CT scanners, MRIs, those are things that could easily be hacked. And those are things that have access to hospital systems. And it's because the providers that were creating this, the companies, whether small or large, they just didn't have this concept of cybersecurity. Daniel talks about how HIPAA came, so long ago. GDPR is probably the most innovative or the most progressive because it's just a little bit, it's newer. But we need to really be having these serious discussions around cybersecurity from a private sector and also from a public sector, and having the private sector understand that part of their innovation has to have a cybersecurity strategy. But realistically, going forward, if we're going to take advantage of artificial intelligence, of what it can do from a predictive and prescriptive perspective, there has to be a balance between security and privacy and being able to share data. I think blockchain is a great way of fundamental technology that can provide that immutability. So those are the types of things that I'd be looking at as well.
Great, thank you. So we just have time for a few more questions here. Thank you all for all of your incredible questions, and we will answer them at some point in the chat. But our next question is going to be surrounding digital therapeutics. The question is, have either of you described any digital therapeutics, clinically validated prescription, pure DTx? Do you think these technologies will play a role in the future? Or do you think that more real-world data and outcomes, digital therapeutics, are the way of the future instead?
Good question. I think they're already sort of here, and they're becoming the wave of the future. Almost every drug that might be prescribed, there's this whole pharmaceutical area, but beyond the pill, we'll have a sort of digital wrapper around it. Let's take a common condition like Parkinson's. Your wearable now can track your tremor. There are even wearable devices that can negate out the tremor, which might be a digital therapeutic. But now if you can measure someone's tremor and tie that to when they take their dopaminergic agents to treat their Parkinson's, that could be an example of a digital therapeutic, or certainly in diabetes care. Sometimes it's just the app itself, like the video games for the brain for treating ADHD that were just FDA cleared. So I think we're moving beyond just the pill or the device or just the software. Software is a medical device, and digital therapeutics from many angles, from mental health perspectives, blending in chatbots, blending in, again, the shared data, knowledge, and personalization of UI are part of that wave of the future.
Yeah, I would double down on the latter, the applications. I think we're already seeing that here, where there's so many examples of that. With smoking cessation, Daniel talked about another one that's out there for smoking cessation is PDA. There's so many VR and gamifications for PTSD. You have Robot and Hair Chat for mental health and talk therapy. And you're seeing that already here, and you're going to see more and more of that over time because it's going back, it's a kind of a mixture of simplification of treatment, right? A lot of things that we talk about, although this is a tech talk, a lot of things boil down to, are you eating appropriately? Are you exercising appropriately? And a lot of digital applications are just going back to more simple types of solutions as opposed to something synthetically made to alter you in some capacity.
Great, and then we're going to end our session today with a final question. We've gotten some surrounding equitable processes and integrity. So we're going to end it with, do you feel that innovation in healthcare will lead to more equitable practices? What do you recommend in addressing some of the barriers, such as digital literacy?
Great question. Briefly, I think my hope is that a lot of these technologies can really enhance health equity and health education. I mean, the bottom billion on the planet all have SMS phones. Soon they'll all have $25 smartphones that can give access to smart triage, your personal AI doctor, virtual care at much lower cost, whether you're in a rural area. In many rural parts of the U.S. have really lousy internet connection, and that needs to be improved as well. So that's part of health equity, is having good bandwidth elements for education, for schools, for health access. But the ability now to personalize that data, precision digital health that meets someone's age, culture, language, incentive structures is all part of this. And that, I think, is part of the power of democratizing healthcare with our new digital connected age.
So I would say potentially yes and potentially no. That the problem is, like Daniel kind of alluded to, you have a digital divide. And so just like COVID has exacerbated underlying systemic inequalities, any new type of technology can do the same. There's a lot of communities, particularly in the US, that don't have access to good bandwidth, good Wi-Fi, good internet. So if you have a new application that solely works over that, then that's a problem. If you can make it work under something that they do have, let's say a smartphone, as Daniel recommended or spoke about, then yes, then that can be helpful. The other thing is artificial intelligence. If you don't have appropriate data, or if you have biased data sets, where you have only a certain demographic perhaps giving their information, like Daniel's a part of a lot of different types of AI data set aggregation as well. Certain communities may not do that, whether it's Hispanics like my own, or African Americans, or indigenous Native American communities. They might not have that kind of access. If you don't have their data sets being aggregated into the overall data sets, then you will perpetuate bias over time. It's just the way that the algorithm goes. The algorithm is amoral. The algorithm is just taking its map. It's just fancy map. You take data and you have fancy map, and that's really what machine learning is. But if the data is biased, it doesn't matter how good the algorithm is, the output is still going to be biased. So we have to try to go out, and the All of Us program that Daniel referenced is trying to do that. And we have to have a more concerted effort. It has to be intentional to seek out marginalized communities to make sure that we are not leaving them behind as we transition to the digital age, because if not, then we are not fixing underlying systemic problems that we have, and that's just the reality.
Amen to that. I would just say we don't just have the social determinants, we have the digital determinants of health. And particularly from underrepresented groups, you can be a data donor. There's Google NIH All of Us trial, and you can become a data donor. And that's meant to be a bit like a Framingham trial on steroids, not just from European Caucasians in Western Massachusetts, but representing the broad socioeconomic and racial groups across the US as one example.
Great, thank you both. And that concludes today's session. I wanted to give a big thank you to our moderator, Amy Protexter, and guest speakers, Dr. Morey and Dr. Kraft. And to the attendees, thank you for your time and the opportunity to come together today. And again, we do encourage you to take a moment to fill out the survey before you leave if you have not already. And with that, we'll turn you back to your day. Thank you.
Bye, everybody.